Well, I think maybe its size. I mean, here it is. It's 1,000 pages. And the fact that the president hasn't read it, and I guarantee you most members of Congress have not read it, and this is pretty much an outline in many pages of what we're going to see, where people are going. And I think that that is the biggest issue. This is a massive, if not radical, restructuring of health care. This particular report doesn't just talk about health insurance, it talks about how we're going to remake Medicare, how we're also going to change a lot of things in the practice of medicine. And I think it's just too expansive for any one person to digest, and we have got to slow down. Well, I think the president is correct. Everybody should have insurance, should have access to insurance that's affordable. However, does it have to be for every person the exact same bells and whistles policy that cost $5,000 or $10,000? You know, most of the people who are uninsured are young people, and you can get a catastrophic policy with some preventive medicine options for $500, $600, maybe $1,000. And I think virtually all of the plans, including this one, put restrictions on exactly how low your premium can be. They want everybody to be paying a hefty premium. And that's hard. People who've just gotten out of college, just starting in a new job. If we could get reasonable policies for those people that they can afford and that are fair for them, then I think we will be able to expand people, and particularly expand access, and particularly the fear that you're going to go bankrupt, or the fear that you'll face a car accident or something horrible and not be able to pay for it. I think that's one terrible misstatement. Cost will go up. They're going to go up for the government, and we're hearing $1 trillion. But you know what? Nobody is calculating what is the cost going to be for the individual. The taxes they're going to have to pay, the compliance, the forms they're going to have to fill out, the bureaucracy they're going to have to respond to. There's a new thing called the Health Choices Commissioner that is going to be basically standing there in Washington deciding what choices you should be making. It's the federal choices that are going to be coming from there. So all of this has a price, and I have not seen any analysis of what the private people are going to have to pay, what you and I, what citizens are going to have to pay. Enough already about the $1 trillion that the government is going to be shelling out. I think the first thing is we've got to get records put on electronically. We have most of the prescriptions are electronic, and we really need to get the medical records electronic. That in itself is a huge task. But then the next question is, who controls it without your permission, either for research or for surveillance? And as it's laid out, having pop-ups appear in the doctor's office as they type in your diagnosis that are thank you from a qualified computer, thank you from the government, I think it does have concerns. That doesn't mean it can't be done, but the public ought to know these differences.